All right, welcome back to the deep dive. Looks like you guys really outdid yourselves this time, sending in excerpts on all sorts of different medications.
Oh yeah, definitely looks like a pretty diverse collection. Lots of interesting stuff in here.
And you know me, I love a good challenge, so we're going to take a deep dive into these neuropharmacological agents, way beyond just their names and basic uses.
Sounds good to me. Love getting into the nitty-gritty of how these things actually work.
Exactly. We're going to untangle the core logic behind how they function, why they're sometimes used for conditions that seem totally unrelated, and really tease out the most surprising and essential aspects of each one without getting too lost in the weeds.
Yeah, we want to give everyone a solid understanding of what makes these drugs tick and how they can be used effectively.
So think of this as your express lane to a richer understanding of these medications. We're looking at their classifications, the conditions they treat, their mechanisms of action, some of which are seriously ingenious, what we're hoping to achieve with them therapeutically, the potential downsides, and the crucial stuff patients and healthcare teams absolutely need to know.
I think what jumps out right away is the sheer ingenuity. When you see the intricate ways we can influence the nervous system, it highlights just how complex neurological disorders are and how sophisticated our tools are becoming.
Okay, let's kick things off with acetazolamide, also known as Diamox. Right off the bat, I was intrigued to see that it's classified as both a carbonic anhydrase inhibitor and a diuretic. It's like it's straddling two different categories.
It is, and that dual action is key to its diverse uses.
Hmm.
So carbonic anhydrase, this enzyme, is involved in various processes in the body. By inhibiting it, we can achieve some pretty interesting effects.
Okay, so how does that translate into actual therapeutic effects?
Well, in the eye, inhibiting carbonic anhydrase reduces the production of a fluid called aqueous humor. This helps to lower the pressure inside the eye, the intraocular pressure, which is crucial in managing glaucoma.
So it's essentially easing the flow of fluid to relieve pressure within the eye. Makes perfect sense for glaucoma.
Exactly. And then on the other side of the coin, we have its diuretic effect, which mainly happens in the kidneys. By promoting the excretion of fluids, it helps to reduce edema or swelling.
Okay, glaucoma and edema, those uses seem pretty straightforward given its dual classification. But then I saw it listed for altitude sickness and even epilepsy. How does this one drug tackle such seemingly different issues?
That's where it gets really fascinating. So, with altitude sickness, it actually helps your body acclimate to lower oxygen levels at higher altitudes.
Okay, but how does inhibiting carbonic anhydrase achieve that?
It encourages your body to get rid of bicarbonate through the kidneys. And that can help to offset the metabolic alkalosis that tends to happen when you ascend to higher altitudes. It's like it's nudging your body's chemistry in the right direction to adjust to those conditions.
So it's not directly treating the altitude sickness, but it's helping your body adapt more effectively.
Exactly. Now, for epilepsy, the exact mechanism isn't entirely clear, but the prevailing theory is that by inhibiting carbonic anhydrase in the brain, it might help to stabilize the activity of nerve cells. This could make them less likely to fire erratically, which is what leads to seizures in some people.
So it's like a ripple effect from inhibiting that one enzyme. It's amazing that a drug for eye pressure can also help with mountain climbing and potentially even seizures.
It really highlights the interconnectedness of these systems.
Definitely. Now, if someone's taking acetazolamide, what are the red flags we need to watch out for?
Well, because it's a diuretic, electrolyte imbalances are a major concern, especially hypokalemia, which is low potassium. Metabolic acidosis is another potential issue. And then there are the more specific side effects. Patients might experience paresthesia, that's a tingling or prickling sensation, and there's a risk of developing renal calculi or kidney stones.
Wow, quite a range of potential issues.
And in some cases, it can even cause confusion, so we need to monitor for that as well.
So, for someone prescribed acetazolamide, what are the essential takeaways?
First and foremost, stay hydrated. And be mindful of your potassium intake. You can get potassium from foods like bananas, spinach, and sweet potatoes. Those are good options.
Good practical advice. Anything else?
Absolutely. Report any unusual tingling sensations to your doctor right away. Also, avoiding too much salt in your diet is generally a good idea. And your doctor will likely monitor your kidney function through blood tests to make sure everything's okay.
Makes sense. All right, let's switch gears completely and talk about alteplase. This one is also known as Activase or TPA. Functionally, it's classified as a thrombolytic agent. That sounds pretty intense.
It is. We're talking about a powerful medication used in those really critical, time-sensitive emergencies. Think acute ischemic stroke, where a clot blocks blood flow to the brain, pulmonary embolism, and myocardial infarction or heart attack.
So in those situations, Every second counts.
Absolutely. Its primary job is to break down those dangerous blood clots that are obstructing crucial blood flow.
And how does it achieve that? It sounds almost too good to be true.
It works by converting a substance called plasminogen, which is naturally present in your blood, into plasmin. Plasmin is an enzyme that acts like a molecular pair of scissors. It specifically targets and dissolves fibrin, which is the main protein that forms the structure of blood clots.
Wow. So it's basically hijacking your body's natural clot-busting system to rapidly clear those blockages.
Exactly. And in those time-sensitive scenarios, that speed is crucial. When blood flow is cut off, especially to the brain, every minute counts. Irreversible cell damage can occur very quickly, so restoring that flow ASAP is the top priority.
It's almost like a race against time.
It really is. And the therapeutic outcome we're shooting for reflects that urgency. Restored blood flow, obviously, and a reduction in all those terrible complications that can arise from clots, like permanent brain damage in the case of stroke.
The benefits are clear. But with a drug this potent, I imagine the potential downsides are pretty serious as well.
They are. The biggest risk, and the one we're most concerned about, is bleeding. And this can happen in many ways, even leading to an intracranial hemorrhage, which can be life-threatening. Another significant concern is hypotension, a dangerous drop in blood pressure.
So it seems like the nursing care and patient education would revolve heavily around preventing and recognizing bleeding.
Absolutely. To minimize bleeding risks, we typically avoid giving intramuscular injections. We also recommend using a soft-bristled toothbrush and an electric razor to prevent accidental cuts.
Smart precautions.
And we monitor coagulation labs very closely. Those tests tell us how well the blood is clotting. Patients and their families need to know to report any unusual bleeding, whether it's from the gums, nosebleeds, unexpected bruising, blood in the urine, or stool, anything out of the ordinary.
So basically, any sign that something might be off with their clotting.
Exactly. And of course, they need to be careful to avoid activities that could cause falls or injuries. And for those who've had a stroke, frequent neuro checks are essential in the hours and days after alteplase is given. We have to watch very closely for any indication of bleeding in the brain.
It sounds like vigilance is key with this medication.
It really is. Okay, moving on to amantadine, also called Simitrol. This one's another multitasker. It's classified as both a dopamine agonist and an antiviral. How does one drug manage to do all that?
Right. It seems like it's wearing multiple hats.
Well, in Parkinson's disease, it helps to increase the release of dopamine. Dopamine is a neurotransmitter that's absolutely crucial for smooth, coordinated movement. So, boosting dopamine can help to improve motor function and reduce some of the classic Parkinson's symptoms.
Okay, so that's the dopamine agonist part. What about its antiviral action?
That comes into play for influenza A. Amantadine can both prevent and treat influenza A infections by interfering with the virus's ability to replicate.
So Parkinson's and the flu, that's a pretty impressive range. What are some of the things to watch out for with amantadine?
Since it affects dopamine and can influence blood pressure regulation, dizziness and orthostatic hypotension are relatively common. That's that lightheaded feeling you get when you stand up too quickly.
Oh yeah, I've definitely experienced that before.
It's important to be aware of. Hallucinations are also a possibility, so we need to keep a close eye on the patient's mental status. Dry mouth is another fairly common side effect that people might experience.
So what are the top things people on amantadine should know?
Slow and steady wins the race, especially when changing positions. That can help to minimize the dizziness and the risk of falls.
Good advice.
Alcohol is also generally a no-no, as it can worsen those effects. If someone experiences hallucinations, they need to tell their doctor immediately. And it's really important not to stop this medication suddenly without talking to their healthcare provider first.
Why is that?
Abruptly stopping can lead to withdrawal symptoms, which we definitely want to avoid.
Makes sense. Now let's move on to a medication that I think most people have heard of, atropine. It's classified as an anticholinergic. When we hear that term, anticholinergic, what should immediately come to mind?
Think about your autonomic nervous system, the one that controls all the automatic functions you don't consciously think about. It has two main branches: the sympathetic, which is your fight or flight system, and the parasympathetic, which is your rest and digest system.
Okay, so how do anticholinergics fit into that picture?
The parasympathetic system uses acetylcholine as its main neurotransmitter to do its job. Things like slowing down the heart rate, increasing secretions, and promoting digestion. Anticholinergics, like atropine, block the action of acetylcholine, so they essentially put the brakes on those rest and digest functions.
So they counteract the calming, slowing down effects of the parasympathetic system.
Precisely. And that's why atropine is used in situations like bradycardia, which is a dangerously slow heart rate. By blocking those parasympathetic signals, it allows the heart rate to increase.
I see.
It's also commonly used before surgery to dry up excessive secretions that helps to prevent airway complications during anesthesia. And then you have emergency uses, like organophosphate poisoning, where it can help to counteract the overstimulation of the cholinergic system.
So by blocking those rest and digest functions, what are we specifically aiming to achieve therapeutically with atropine?
It depends on the situation. Sometimes the goal is simply to increase the heart rate when it's dangerously slow. Other times it's about reducing secretions to prepare for a procedure. It all comes down to what those parasympathetic effects are doing that we need to counteract.
And I remember learning about the classic anticholinergic side effects. There's a whole mnemonic for it,
You
right?
got it. Dry as a bone, blind as a bat, red as a beet, mad as a hatter, hot as a hare.
Oh, yeah, I remember that one. So dry mouth, blurred vision because the pupils are dilated, flushing of the skin, confusion, and decreased sweating.
Exactly. You can also have tachycardia, a rapid heart rate, and urinary retention.
So it sounds like a big part of nursing care and patient education would focus on managing and recognizing those effects.
Absolutely. Continuously monitoring heart rate and regularly checking for urinary retention are essential. For dry mouth, good oral hygiene and plenty of fluids can help, and sometimes sugar-free candy or gum can provide some relief.
Well, tips.
And it's crucial to educate patients to be careful in situations where blurred vision could be dangerous. Since their ability to sweat might be reduced, they also need to avoid activities that could lead to overheating.
Next up is benztropine, also known as Cogentin. It's listed as both an anticholinergic and an anti-Parkinsonian medication. How does that work? Is it just like atropine but for Parkinson's?
Well, they are both anticholinergics, but benztropine has a more targeted application when it comes to managing Parkinson's disease and drug-induced extrapyramidal symptoms. Those are movement disorders like tremors or rigidity that can occur as side effects of certain antipsychotic medications.
Okay, so it's not a primary treatment for psychosis, but it can help with some of the movement-related side effects.
Exactly. Now, in Parkinson's disease, there's an imbalance of neurotransmitters in the brain, a dopamine deficiency, and a relative excess of acetylcholine in certain areas. Benztropine steps in to try and restore some of that balance by specifically blocking the action of acetylcholine in those areas.
So it's essentially trying to dial down the overactivity of acetylcholine.
Exactly, and that can help to lessen the tremors and muscle stiffness that are so characteristic of Parkinson's.
So what kind of improvements do we actually see with benztropine?
Ideally, we want to see a noticeable reduction in the severity of those Parkinsonian symptoms, especially the resting tremor and muscle rigidity. That can lead to improvements in overall motor function and hopefully an enhanced quality of life for the patient.
And I'm guessing since it's an anticholinergic, the adverse effects are going to look a lot like what we see with atropine.
There is significant overlap. Dry mouth, constipation, urinary retention, and blurred vision are all potential issues. But there are a couple we pay particularly close attention to with benztropine.
Which ones are those?
Confusion and cognitive impairment, these can be especially problematic in older adults who tend to be more susceptible to these central nervous system effects.
So what are the key monitoring points for nurses and patients when it comes to benztropine?
Keeping a close eye on bowel and urinary function is essential. Constipation and urinary retention can be real problems. We also regularly assess the patient's mental state, looking for any signs of confusion, disorientation, or memory issues.
That makes sense. Anything else?
Encouraging plenty of fluids and fiber can help with constipation. As with many of these medications, alcohol should be avoided, as it can make those CNS effects much worse. And again, we don't want to stop this medication abruptly. It's always best to taper off gradually under a doctor's supervision. And for dry mouth, simple things like chewing sugar-free gum or sucking on hard candy can provide some relief.
Great advice. All right, let's move on to a medication that's used specifically for the eyes, cardiolol, or Ocupress. It's classified as an ophthalmic beta blocker. How does a beta blocker in eye drop form work to manage glaucoma?
Ophthalmic beta blockers like cardiolol help to lower the pressure inside the eye by reducing the production of aqueous humor, that's the fluid that's constantly being produced and drained within the eye.
So they're targeting that fluid balance to manage the pressure.
Exactly, and they do this by blocking beta-adrenergic receptors in the ciliary body, which is the part of the eye that makes aqueous humor.
So it's a very localized action within the eye itself.
Yes, that's the idea. Because it's applied directly to the eye, the main action is confined to that area.
So the therapeutic outcome is pretty clear-cut, a reduction in intraocular pressure. But even though it's an eye drop, are there still potential systemic effects from the beta blocker aspect that we need to watch for?
There can be. Even though we're applying it topically, some of it can still get absorbed into the bloodstream. So we have to be on the lookout for things like bradycardia or a slow heart rate, hypotension, or low blood pressure. Those are classic beta blocker effects. And locally, in the eye itself, you can have irritation, stinging, and temporary blurred vision.
That makes sense. So what are the essential points for nurses and patients to keep in mind with cardiol eye drops?
Nurses will be checking the patient's intraocular pressure to see how well the medication is working, and will also be keeping an eye on their pulse and blood pressure, especially when they first start treatment.
Okay, and what about patient education?
One really important technique we teach patients is to apply gentle pressure to the inner campus of the eye. That's the corner closest to the nose right after they put the drops in. This simple action helps to keep the medication from draining into the tear duct and being absorbed systemically.
Clever.
It's a really effective way to minimize those potential side effects. Patients should also avoid rubbing their eyes, and it's important for them to understand that they shouldn't stop using the eye drops abruptly without talking to their doctor.
All right, next up is dantrolene, or Dantrium. This one is classified as a skeletal muscle relaxant. What makes it unique in the world of muscle relaxants?
Dantrolene works in a very different way than most muscle relaxants. Instead of primarily acting in the central nervous system, it works directly on the skeletal muscles themselves.
Interesting. So it's targeting the muscles at a more fundamental level?
Exactly. It does this by interfering with the release of calcium from the sarcoplasmic reticulum, that's an internal storage area within muscle cells. Calcium is essential for muscle contraction, so by reducing its release, dantrolene directly prevents the muscles from contracting, and that leads to muscle relaxation.
I see. So it's kind of like cutting off the fuel supply for muscle contractions.
That's a great analogy. This direct action makes it very effective for specific situations, like malignant hyperthermia, a rare but very serious reaction to certain anesthetics, as well as managing chronic spasticity, which you might see in conditions like cerebral palsy and multiple sclerosis.
So it sounds like it has a very specific niche in muscle relaxation.
It does. In those chronic conditions like cerebral palsy and MS, the goal is to reduce muscle spasticity, which can help to improve mobility and make the patient more comfortable. And in malignant hyperthermia, it can actually be life-saving by stopping that dangerous hyperthermic crisis.
Powerful stuff. But I imagine a medication that acts so directly on muscles might have its own set of potential downsides.
Definitely. One of the big ones is hepatotoxicity damage to the liver. This is especially a concern with long-term use, so regular monitoring of liver function tests is absolutely essential.
Okay, that's a big one. Anything else?
You can also have drowsiness, overall muscle weakness, and dizziness.
So what are the key things to focus on in terms of nursing care and patient education with dantrolene?
Nurses will be monitoring liver function very closely, checking blood tests regularly. We'll also be regularly assessing muscle strength to make sure there's no excessive weakness.
Makes sense.
When starting treatment, we usually start with a low dose and increase it gradually to minimize those side effects. And it's crucial for patients to avoid alcohol, as it can increase the risk of both liver problems and drowsiness. We also educate patients about recognizing the signs and symptoms of liver damage, things like jaundice, yellowing of the skin or eyes, persistent fatigue, or abdominal pain. If they notice any of those, they need to report it to their doctor right away.
Good advice. Let's move on to another familiar medication. Dexamethasone, also known as Dicodrone. It's a corticosteroid. These medications are often used in a huge variety of situations, right?
They are. Dexamethasone is a potent synthetic corticosteroid with powerful anti-inflammatory and immunosuppressant effects. We use it for a wide range of conditions: reducing cerebral edema, which is swelling in the brain, managing inflammation throughout the body, suppressing allergic reactions, the list goes on.
Wow, it seems like it has a hand in so many different processes. So how does it actually work?
Gets pretty complex, but essentially it interferes with the body's immune response and reduces inflammation at a cellular level. It does this through several different pathways.
And I imagine the therapeutic goals are just as varied as its uses.
Absolutely. For cerebral edema, the aim is to decrease the swelling and reduce intracranial pressure. In inflammatory conditions, it's about alleviating pain, redness, and swelling. And in allergic reactions, the goal is to calm down that overactive immune response.
So it's about restoring balance in different ways.
Exactly. But we have to remember, with such widespread effects, the potential for adverse effects is pretty broad as well.
Right. What are some of the things we need to watch out for?
Hyperglycemia or high blood sugar is a big one, especially important for people with diabetes or those who are at risk.
Okay, so blood sugar monitoring is key. Anything else?
Because it suppresses the immune system, patients are at an increased risk for infections. Osteoporosis or thinning of the bones can happen with prolonged use, and fluid retention can lead to swelling and higher blood pressure.
It sounds like managing a patient on dexamethasone involves a lot of careful monitoring for all those potential complications.
It absolutely does. We monitor blood glucose very carefully, especially in patients with diabetes or prediabetes. We're constantly vigilant for any signs of infection, any fever, redness, swelling, anything that seems out of the ordinary.
And what about when it's time to stop the medication?
When discontinuing dexamethasone, we taper the dose down slowly. We never stop it suddenly because that can cause problems with the adrenal glands.
So it's about giving the body time to adjust.
Exactly. And it's really important to educate patients about all of this. They should take the medication with food to minimize stomach upset. They should try their best to avoid contact with people who are sick. And they need to know the signs of infection and report them to their doctor immediately.
All right, moving on to another ophthalmic medication, dorzolamide, marketed as Trusopt. This one is used for glaucoma, but it's a carbonic anhydrase inhibitor, like the oral acetazolamide we talked about earlier. How do they differ?
The key difference lies in how they're given and where they mainly work. Dorzolamide is an eye drop, so its effects on carbonic anhydrase are mostly limited to the eye.
So it's about that localized action again.
Exactly. By inhibiting carbonic anhydrase in the eye, it reduces the production of aqueous humor right there, helping to lower that intraocular pressure.
Makes sense. So the goal is the same as with acetazolamide, lower eye pressure, but the side effects might be different because of that localized action.
Yes, generally speaking, dorzolamide tends to cause more localized side effects, mostly in the eye itself. Things like irritation, stinging, or burning when you put the drops in. Some people report a bitter taste in their mouth, which happens when the medication drains through the tear duct.
I can imagine that wouldn't be too pleasant.
And conjunctivitis, or pink eye, can also happen.
So less of a concern about those systemic effects we talked about with acetazolamide.
Generally, yes, because less of the drug gets absorbed into the bloodstream.
What are the key things nurses should teach patients about using dorzolamide eye drops safely and effectively?
We always monitor intraocular pressure to see if the medication is doing its job, and we'll ask the patient about any eye discomfort they're experiencing.
Okay, what about the actual administration of the drops?
Teaching proper technique is really important. We emphasize not touching the tip of the dropper to the eye or anything else that helps prevent contamination. And after putting the drops in, we teach patients to apply gentle pressure to the tear duct, that little corner of the eye by the nose, for a minute or two. This helps to minimize how much of the medication drains into the nasal passage and can reduce that bitter taste.
Good tips. Let's move on to a medication used for multiple sclerosis, gladaramor or Copaxone. It's classified as an immunomodulator. What does that even mean? What's an immunomodulator?
Immunomodulators are a group of medications that help to regulate or modify the activity of the immune system. And in multiple sclerosis, that's exactly what we need to do.
Why is that?
In MS, the body's own immune system mistakenly attacks the myelin sheath, which is the protective covering around nerve fibers in the brain and spinal cord.
So the immune system is basically turning against the body.
In a way, yes. And glutamer is thought to work through a few different mechanisms to try and modulate that immune response. One of the key things it does is shift the balance of immune cells. It promotes the production of anti-inflammatory cells, which are the good guys, and reduces the activity of the pro-inflammatory cells that are causing the damage to the myelin.
So it's like it's trying to retrain the immune system to behave properly.
That's a good way to think about it. And ultimately, this helps to reduce the frequency and severity of MS attacks or relapses.
So fewer relapses, that's the main goal we're after.
Uh-huh.
What about side effects? What do we typically see with gladaramor?
The most common side effects are related to the way it's given by injection under the skin or subcutaneously. So you often see redness, swelling, pain, and itching at the injection site.
Makes sense.
Some people also get what we call a post-injection reaction. This happens shortly after the injection, and it can involve things like chest pain, flushing, shortness of breath, or anxiety.
It's a little scary.
It can be, but it's usually brief and goes away on its own. Flu-like symptoms can also occur, but they're generally manageable.
So what are the most important things for nurses and patients to know about using glatiramer?
We make sure to teach patients the proper way to inject it subcutaneously. We emphasize the importance of rotating the injection sites that helps to reduce those local skin reactions. And we always monitor for any signs of an allergic reaction, though those are rare.
Okay, good to know.
And it's really important to educate patients about those post-injection reactions. We want to reassure them that those reactions are usually not dangerous and will pass quickly. But of course, if they have any concerns, they should always contact their healthcare provider.
All right, next up is interferon beta, which has a few different brand names. Avonex, Rebif, and Bitoseron. This is another immunomodulator used for MS. Does it work similarly to glatiramer?
They're both immunomodulators for MS, but they have slightly different mechanisms. Interferon beta is a naturally occurring protein that helps to regulate the immune system. As a medication, it's thought to work in MS by reducing inflammation in the central nervous system and slowing down the disease's progression.
Okay, so both aim to reduce relapses, but through different pathways.
Exactly.
What about the side effects of interferon beta? What should people be aware of?
Flu-like symptoms are very common, especially when you first start taking it. Think fever, chills, muscle aches, fatigue, that sort of thing. The good news is that they often lessen over time.
Okay, good to know. Anything else?
Depression is another potential side effect that we need to be mindful of. And in some cases, you can have liver toxicity, so we monitor liver function tests regularly.
So how do we manage these potential side effects?
We keep a close eye on the patient's mood and watch for any signs of depression. We also check liver function periodically through blood tests. Patients are often advised to take over-the-counter pain relievers like acetaminophen or ibuprofen around the time of their injection that can help to manage those flu-like symptoms.
Makes sense. Anything else?
Just like with glatiramer, proper injection technique and rotating injection sites are really important. And we need to educate patients about those mood changes. If they're having significant or persistent feelings of sadness or hopelessness, they need to let their healthcare provider know.
All right, moving on to mannitol, also known as osmotrol. This one is classified as an osmotic diuretic. What does that osmotic part tell us about how it works?
In diuretics, osmotic refers to the way the drug pulls water across cell membranes. Mannitol is a type of sugar alcohol. When it's given intravenously, it increases the osmolarity of the blood. That means it increases the concentration of solutes in the bloodstream.
Okay, so it's making blood more concentrated. How does that help?
That higher concentration creates a gradient that pulls fluid from areas where the solute concentration is lower, like the brain tissue in cerebral edema, into the vascular system. So you're essentially drawing excess fluid out of the tissues and into the bloodstream.
I see. So it's using the principles of osmosis to shift fluid where we need it to go.
Exactly. And then that increased fluid volume in the bloodstream leads to increased urine production as the kidneys filter out all that extra fluid along with the mannitol itself.
So it's pulling fluid out of tissues and then flushing it out of the body. Makes sense.
Exactly. The desired outcomes are pretty straightforward. We want to see a reduction in swelling in the brain or wherever the problem is and an increase in urine output. But we have to be very aware of the potential risks with these rapid fluid shifts.
What are the main concerns?
Well, the biggest risks are fluid and electrolyte imbalances. If fluid replacement isn't keeping up with the increased urine output, dehydration can be a real problem. And in some situations, it can actually increase the blood volume initially before the diuretic effect fully kicks in. That can put a strain on the heart.
Okay, so managing fluid balance is really crucial with this medication.
Absolutely. And we also have to watch out for hypotension or low blood pressure, which can occur because of these fluid shifts.
So close monitoring is essential.
Absolutely. We monitor urine output continuously, check serum electrolyte levels regularly, and keep a close eye on the patient's neurological status. Another important point for nurses, mannitol can sometimes crystallize, especially if it gets cold. So we use a filter in the IV line during administration to prevent those crystals from getting into the patient's bloodstream.
Good to know. What about patient education for mannitol?
We make sure patients know to report any dizziness, as that could signal changes in their fluid balance or blood pressure. And we stress the importance of carefully tracking their fluid intake and output.
Okay, let's talk about another skeletal muscle relaxant. Methocarbamol, also known as Robaxin. How does it compare to dantrolene, which we discussed earlier?
Dantrolene, as we learned, works directly on the muscle fibers. Methocarbamol is different. It's thought to work mainly in the central nervous system.
Interesting.
It basically has a sedative effect that helps to reduce how much the patient feels the muscle spasm and pain. It doesn't directly interfere with muscle contraction at the cellular level like dantrolene does.
So more of a central effect rather than a direct effect on the muscles.
Exactly. And we typically use it for acute muscle spasms and the pain that comes with them, often related to muscle injuries.
And because of that CNS action, I'm guessing the effects are more widespread.
They are. Drowsiness and dizziness are really common side effects, as you might expect with a CNS depressant. Nausea can also happen.
What are the things nurses and patients should be especially mindful of with methocarbamol?
Nurses will monitor patients for excessive sedation, making sure they're not too drowsy. And we always assess their risk for falls, as the dizziness can make them unsteady.
Makes sense.
We advise patients to avoid stopping the medication suddenly, as that can sometimes cause withdrawal symptoms. We also make sure they understand the sedative effects and strongly advise against drinking alcohol while they're on this medication that can make the drowsiness much worse.
Next up, we have methylphenidate, which most people know by its brand names Ritalin or Concerta. It's a central nervous system stimulant. What does that mean for brain activity? How does it actually work?
Methylphenidate mainly increases the levels of two key neurotransmitters, dopamine and norepinephrine.
And those are involved in.
These neurotransmitters play a huge role in attention, focus, and alertness. What? Methylphen?